Thanks very much, and thanks for coming to the presentation. So this is Australian data looking at the risk factors for newly acquired hepatitis C, and you can see injecting drug use accounts for about 82% of cases. So the next question is, who do we test? So these are the recommended groups that we test. Firstly, people who inject drugs currently or who have ever injected drugs, sex workers, people in custodial settings. So if we don't do anything about what's happening now, we're going to end up with a bigger burden of disease on the severe end of the spectrum.
So a very bare bones patient workup. I think this is the absolute minimum. When you go through the consensus statement, there is more detail about the various different steps, but this is the absolute minimum that's required. Hepatitis C genotype. Hepatitis C viral load if you're thinking about short duration treatment in people with no cirrhosis. This is the PBS indication for prescription. So patients must be aged, so at the moment treatment's for adults only. Patients must be 18 years or older. Patients must be treated by a gastroenterologist, hepatologist or infectious diseases physician. Hepatitis C infection is now curable, and the cure is associated with improvement in quality of life, loss of infectivity and prevention of transmission, as well as regression of cirrhosis, lower risk of liver failure and liver cancer, and reduction in mortality. And so every Australian now who's living with hepatitis C should be considered for treatment.
And so the Hep C pathway looks a little like this. So it has an about section which will tell you in very concise terms what you've heard tonight. Risk factors, liver cirrhosis, how to assistance in how to actually diagnose that, and also the tests that we've been through tonight. And the clinical guidance is actually what Alex was talking about. So there's a link there to the handout, which is actually a very, very nice description of and a concise description of what you need to know in order to prescribe.